field agency outline. So the social problems being addressed by my agency, I'm currently employed by and also doing my practicum through the Tacoma Pierce County Health Department's treatment services program. And under that umbrella is where I'm doing my practicum, which is their methadone clinic. So the methadone clinic works to address the issue of opioid addiction for Pierce County and surrounding areas. Some social policies, laws, and practices that impact the client system and delivery of services. One of the major impacts of service delivery is the federal opioid treatment standards. So they set the guidelines for the service delivery of OTPs, opioid treatment programs, and what is expected of them, especially for methadone programs, as they're usually the most stringently policed programs, especially in America. Another policy that impacts services and delivery is 42 CFR. So 42 CFR outlines ethical requirements for those practicing with individuals seeking substance use treatment and are similar to HIPAA, but oftentimes much more strict. So for instance, continuity of care is not covered under CFR 42 the same way that it is under HIPAA, and it is required to have a written release of information for every disclosure, unlike HIPAA, which allows for verbal releases when appropriate. A practice that is utilized within the agency is a strengths-based perspective, so building off of a client's existing strengths and using those to support their recovery during their time with the agency is key both to the agency as well as with Medicaid reimbursement. So for the board directors, and since I'm a county agency, they're also like the county supervisors and sort of what they do. So the Tacoma Pierce County Health Department is a joint venture between the city of Tacoma and the greater Pierce County. Because it is a joint health department, we have various city and county government members, as well as people who are appointed to be on the board. So the board members right now are Catherine Ushka, Keith Blocker, Derek Young, Marty Campbell, Bruce Damier, William Hirota, MD, Patricia Johnson, Dave Morrell, Robert Baggett, John Hines, Ken Farmer, and Janny Hitchin. And I imagine their names don't really mean anything to you if you're outside of Pierce County. But here we are. What I think is really cool about the way that our health board is set up specifically is we have a, what did I say? We have a guaranteed appointed seat from the Pierce County Medical Society. So that ensures that no matter what, under any circumstances, we will always have at least one medical doctor on our board of health who's going to be like a part of the decision making for all public health policy that's going on in our county and in Tacoma as well. And so what's really cool about that is the role of the board of directors is to provide all of the policy level decision making regarding public health for Pierce County with input from our executive director, Anthony Chin, MD. So at any given time, there is 2 medical doctors that are giving their opinion on our public health policy. So that's really cool. So the major programs operated by the agency. The Tacoma Pierce County Health Department is a huge agency with over a dozen programs that provide a range of services to best serve the community. So more specifically, their direct services are housed under this program called Strengthening Families. Under Strengthening Families umbrella includes racial justice, parent, family, and child health, behavioral and emotional health, and treatment services. So racial justice works to implement evidence-based community interventions to address the public health issue of racism. Much of what they do is aimed at increasing equity across the board for our community members. They provided community and agency trainings. They work to provide PPE for Black Lives Matter protests. They provided statistics to back the need for interventions for a range of services in the community to agencies and local government. And they do a lot else. For the parent, family, and child health, their program is focused on improving health outcomes and addressing issues concerning health equity in our community. Their programs include Black Infant Health, that provides support and advocacy to parents of Black infants in a number of ways and helps them to engage with their community supports to address health inequities among Black infants. We have a nurse family partnership, which provides expecting first-time mothers personal nursing support to improve health outcomes among their upcoming babies and to help improve rates of breastfeeding and immunization. Excuse me. They have a program called Children with Special Healthcare Needs, which provides resources and advocacy for the parents as well as the providers, so like their pediatricians or whoever they go to for their child's health services. Specifically aimed for children with more complex health needs. And lastly, we have a breastfeeding policy program that aims to improve rates of breastfeeding and make peer support services more accessible, especially for women of color. So for the behavioral and emotional health program, they have two programs under their umbrella. So they have a school-based emotional support program that goes and provides trainings regarding different aspects of mental health, and like their main focus is reducing suicide rates among teens. They also have a program that is focused on reducing substance use among teens, especially with nicotine and marijuana. Lastly, treatment services includes two programs, our methadone clinic and a grant-funded program called Meds First. So the TPCHD methadone clinic was the first in Pierce County and has been working tirelessly to provide opioid disorder treatment to people in need. Meds First is a grant-based program studying the efficacy of low barrier Suboxone treatment, and will soon be evolving to focus on studying the efficacy of contingency management for those seeking treatment for their substance use disorders. So even while we move towards like focusing more on the contingency management aspect of it, we're still going to be providing services through the Meds First framework, which is to be able to get anyone who's interested in medication-assisted treatment on medication-assisted treatment and make it as easy to stay in services as possible. So our funding sources. Most of the funding for my program is through Medicaid. Medicaid's guidelines, as well as the federal opioid guidelines, are what most guide the funding for TPCHD's methadone program. For our leadership, Sabrina Chambers provides oversight for our entire division. She is responsible for managing all the funds that are directed towards our agency and making sure that we're keeping true to the mission statement of all of our divisions and providing adequate services to meet our community's needs. So she runs Strengthening Families, so the big kind of overarching umbrella that I was just talking about. She's in charge of all of that. Next is Elisa Solberg. She's the Treatment Services Program Manager and handles all of the program requirements of our agency and makes sure that we're meeting state and federal guidelines for provision of services. After that is Amanda Robinson. She is the clinic coordinator. She is in between administration and direct service personnel. She makes sure that all the staff members' needs are being met, as well as follows the SUDP3s. So those are kind of like the middle management people. So they're the ones who are like the direct supervisors for people, to make sure that everyone's meeting their numbers. And then as far as like the people that I work with every day, there are really only two staff members that I meet with. My AFI, who's the MSW, his name is Rodney. He is a Health Promotion Tech 3, which is kind of like a catch-all term for any job that doesn't fit neatly into our pre-existing positions. And since he's a 3, that would be a supervisory. Basically what he does is quality control for the methadone clinic, so he makes sure that everyone's like keeping on task, they're following evidence-based practices, doing all of that. He also provides supervision for anyone who is going after licensure as a mental health professional. So we have an LMHCA, which is a licensed mental health counselor associate right now. And then if I stick around, there'll be me when I'm going after my LICSW. We also have a peer navigator. Her name's Charnay, and I'm kind of doing exactly what she does. So she is funded through this program called Elevate Health. They are partnered with Pierce County, and they provide navigation services for anyone in the county who needs them who doesn't qualify for health homes, which is another program that's directed towards high utilizers, so people who use a lot of state and federal funding by going to like the emergency department super often or going to inpatient all the time. So anyone who doesn't meet the criteria for them gets put into Elevate Health if they're interested in services. Our mission is we help our communities become healthier places to live, learn, work, and play. We make sure people have access to healthy food and healthy environments. Water is safe to drink, air is safe to breathe. So that is for the health department as a whole. The goals of strengthening family are as follows: helps children, families, and communities thrive. We provide family support for your child's early years, substance abuse prevention, education, counseling, and treatment, comprehensive community oral health. So community collaborations and development. Pretty much every program that we have is developed out of a community partnership or need. But what I think is most impressive are our racial justice program and our Black infant health program. So our racial justice program was born out of a historical need that has gained a lot of national attention in the last few years. Racism has been classified as a public health crisis, and a lot of agencies around the nation have been working to implement evidence-based community interventions to address inequity for Black, Indigenous people of color. So for our program specifically, we had a group of employees that came together to make a proposal to our board to start a racial justice initiative following the Eric Garner murder. And they were approved for funding to start implementing community interventions. Black Infant Health is another program that I was very impressed by. So I've been working in the community here for a long time, and I'd never heard of their program until I started working there. So they're connected with a lot of different community agencies, but what's really cool about them is they're affiliated with a lot of Black churches in the area, and they have a goal of providing a sense of community for mothers to make sure that they always have like a level of support even when they aren't able to get that from like a formal support. So our method of delivery. The service delivery model for my internship is primarily case management, group facilitation, and administration. From a case management perspective, I've been working with a couple of clients to help meet their needs as they define them. I use a person-centered perspective to explore what they need and what they want out of our time together. On a group facilitation level, I have mostly been writing curriculum for a couple of upcoming groups that we're hoping to establish. One of them is a DBT skills group. The primary evidence base for that group is dialectical behavioral therapy. I'm pulling handouts and worksheets out of DBT's founder, Marsha Linehan's skills manual to inform all the curriculum I'm building. For the other group, the peer navigator that I'm working with wants to establish a taper group for patients who are trying to taper off of their methadone doses. And so the evidence base for that is we're using motivational interviewing for like our group dynamic, and then also psychoed. So the psychoeducational pieces are going to be more focused on the actual aspects of tapering, like sort of what they can expect from that, and then I'm going to be handling most of that. The peer that I work with is going to like take it from there after we do the psychoed lesson. So she's going to talk about her experience. We're going to prompt people to talk about theirs, share any insight or wisdom that they have, and then see if anyone needs any support. And then as far as accountability goes, I don't have a lot of data that I have to collect. I'm not administering scales or any sort of measuring tools for clients. All I really have to worry about is what's in their ISP, their individual service plan, and then helping them get connected with resources that are relevant to them. And then with every interaction that I have with clients, I have to write a note my AFI has to sign off on all of those, so I route them to him. And then we talk about them during supervision and we see if there's anything that he would suggest that I do differently. Well, thank you for letting me share my outline with you. I'm looking forward to your feedback.